Prime Minister Lee, Ministers, President of the International Social Security Association, Excellencies, ladies and gentlemen, it is truly an honor to participate in the opening of this 21st World Congress on Safety and Health at Work. And I have to say that the presence of all of you today, all 3,484 of you, is indeed testimony to the global significance of the event which now begins. Prime Minister, thank you for the invitation for us to come to Singapore and for me to join you. It's a great pleasure to be back here. As has been said, the ILO is a co-organizer, and we're proud to be a co-organizer of this event with our colleagues at ISA, and I think I can speak for us both when I say we owe a tremendous debt of gratitude to Minister of Manpower Lim and his wonderful team. They have shouldered much of the organizational responsibility of bringing us together. Ladies and gentlemen, 3 years ago, at the 20th World Congress in Frankfurt, I said that safe and healthy work sits alongside fundamental rights at work and is a foundational element to sustainable development. And yet, today, we are announcing the new global figures on work-related illnesses and injuries developed by Finland, Singapore, the European Union, and the International Commission on Occupational Health, with the support of the International Labour Organization. And what does that data show? It shows that some 2.78 million workers continue to die each year from work-related injuries and illnesses, and that 2.4 million of those are the result of work-related diseases. And while the number of injuries is going down in developed countries, they continue to grow in developing countries. And these work-related deaths, illnesses, and injuries continue to cause incalculable human suffering. This is an unacceptable and unavoidable toll on human lives, and it is an imperative for us all to act together to bring a difference. And let's be clear, the right to safety and health at work is a human right. There is no price to a human life lost or a human life destroyed. But if further reasons were needed for us to act to invest on safety and health, they might also be found in the extraordinary economic costs to workers, to their families, to businesses, and to national economies from this state of affairs. The global economic impact of the current situation is currently estimated to be 3.94% of global GDP per year. That adds up to $2.99 trillion US. And if you have trouble wondering what $2.99 trillion US really means, let me say that it roughly equals the total GDP of the poorest 130 countries in the world. That's the price that's being paid. Ladies and gentlemen, these numbers, along with the growing body of evidence of the benefits of sound OSH practices to productivity and to successful enterprises, as well as the reality of the all too frequent catastrophic workplace accidents that happen, has resulted in a steadily increasing demand since our Congress in Frankfurt for improvement, for qualitative improvement in safety and health of the world's workers. And it's encouraging that that demand has resulted in significant commitments by world leaders to prioritize safety and health at work. And with the adoption by the United Nations of the 2030 Agenda for Sustainable Development, occupational safety and health has been fully and explicitly recognized as a priority of the global development agenda. That is to say, a key to a better future, leaving nobody behind. Now, clearly, certain OSH challenges are global challenges and as such require global solutions. This morning, I was participating in the special event on the future of work and OSH. At that meeting, Finland's Minister Mattila launched the idea of a global OSH coalition on safety and health at work. And I was able to say then, and I want to reiterate it before this public today, that the ILO strongly supports this initiative and is anxious to work with all interested partners to bring it into being. And I invite you to join in that effort. So let me briefly outline what seem to me some of the elements of these global challenges. I just briefly want to outline 5 of the challenges that I think we need to address. Firstly, we need OSH data that is reliable and comparable, coupled with key indicators that will drive improved performance. Now, the new and more robust global and regional OSH estimates I have referred to result from collaboration amongst the ministries and institutes of Finland and Singapore, the International Commission on Occupational Health, and EU OSHA, as well as the work of the ILO. And I think that's an example of what a coalition of actors can achieve in the future. The ILO is working with the World Health Organization to design a common methodology that can be used in the future by both organizations to develop global OSH estimates, and researchers working with the International Commission on Occupational Health and researchers around the world. But with all of that, it has to be understood that these efforts will only produce results if national data collection systems improve. To really know the number of work-related injuries and diseases, member states must redouble their own efforts. Second challenge, I believe we must give priority to those most vulnerable at work. And that means that the safety and health of migrant workers has to be a global concern. The international community recognizes that overall, migration governance is weak and it is fragmented. And we know that migrant workers often work in hazardous jobs and in far too many cases are not properly covered by labor, health, and social protections, or if they are, their ability to access protections is often thwarted by factors such as language and cultural barriers, and even isolation and discrimination. Now, the ILO is working to address these issues through its own Fair Recruitment Initiative and its engagement in the development of the United Nations Global Compact on Migration. But I suggest that this is a work for us all. A third global challenge is improving OSH in global supply chains. In 2016, the ILO conference addressed this question and identified the need for greater knowledge about working conditions in enterprises along the chains. In response, we are piloting a methodology for identifying OSH vulnerabilities in the agricultural supply chain and developing targeted interventions accordingly. And these include assisting labor inspectorates to strengthen their capacities and to engage stakeholders who are positioned to influence compliance. And work like this is being integrated together under an overarching single ILO strategy supported by the ILO-administered Vision Zero Fund, which was created by the G7 grouping and addresses OSH in global supply chains. And this initiative was welcomed by the G20 earlier this year. Fourth global challenge is creating mechanisms for the global sharing of OSH data, knowledge, and expertise, and finding the means to sustain such networks. Now, the ILO has already completed a global survey establishing a comprehensive compilation of OSH institutions, organizations, and agencies and their scope of work. And it is also supporting existing international and regional networks. But I think, again, we need to take this work forward together. And ladies and gentlemen, the last of the global challenges I want to highlight has to do with the future of work and their implications for the safety and the health of working people. For many decades now, we have been reacting to the growing body of evidence on work-related hazards and their impact on workers' health and safety. By and large, our energies have been directed towards retrofitting work and workplaces to eliminate hazards after significant harm has already been done. Think of asbestos. Think of ergonomic hazards, and you get the idea. And as our knowledge of occupational safety and health hazards has grown, and as its scope expanded beyond physical, biological, and chemical hazards to psychosocial hazards and hazards related to work organization, I believe it is now more clearly understood that all work has an impact, positive or negative, on workers' health and safety. With this knowledge, when we look to the future of work, we can no longer have a wait-and-see attitude. We need to anticipate the impact that future jobs, future ways of organizing work will have on the safety and health of workers. And that responsibility doesn't rest only with governments and with employers and workers, but also with the developers of technology, with designers and manufacturers of equipment, machinery, and chemicals, with architects, with OSH experts, and with human resource professionals. And what this tells us, I think, is that taking a proactive, prevention-based approach in improving safety and health and efforts to create a culture of prevention continues to be the right approach. And the key ILO instruments, Conventions 155 and 187, and instruments such as the ILO's Management System Guidelines, I do think equip us with mechanisms to anticipate the emerging future of work. But this approach is being challenged by changes in production and work organization. As new and diverse forms of production emerge, we are confronted with questions such as who is responsible for safety and health in a global supply chain, for workers in the platform economy, for workplaces that are in workers' homes or on the other side of the globe. And when we figured all of that out, how do we intend to regulate and to enforce that responsibility? Ladies and gentlemen, we all know from experience that workplaces where there are trade unions, collective agreements addressing safety and health, and active safety and health committees, they are safer and healthier workplaces. And we have to think about that, about the future mechanisms and agencies of tripartism and social dialogue. Will they be robust and adaptable enough to meet the needs of a transformed global economy? Because of all of these challenges and many others, the ILO has decided to mark its centenary in 2019 with a centenary initiative on the future of work. And we launched a global commission on the future of work just last month under the co-chairing of the Prime Minister of Sweden and the President of Mauritius. I feel that that global commission, as it starts its work, will benefit enormously from the inputs and the views expressed at this conference. To conclude, ladies and gentlemen, when we speak, as I am, of the future, I believe we must speak of youth. For this World Congress, with assistance from the Singapore Ministry of Manpower, the ILO has organized, as part of our Safe Youth at Work project, funded by the US Department of Labor, a parallel youth conference, bringing to Singapore 125 young OSH champions committed to improving the safety and health of young workers. 40 million young people enter the world's labor markets every year. They are the best educated generation our world has ever seen. And we need to take advantage of their skills and the demographic dividends they can bring by expanding investment in youth employment. But as we seek youth employment, we know that that will be for naught if on the first day on the job or any other day a young worker is injured or killed. How the future of work is forged will, of course, have the greatest impact on this and the next generation, and they must have a voice in the process, including on OSH. So I want to encourage you to engage with our youth champions who are amongst you. They're the ones with colourful scarves, a smile on their face, and even more energy than the rest of you. Engage with them, make them part of the story, and may this story of this Congress be one of success and determination for the future. I thank you.